Hi, my name's Lee,
And I'm Zena.
and welcome to our tutorial video on teaching the fundamental motor skill, the overhand throw. In this demonstration, I'll be the teacher.
And I will be the student.
The overhand throw is a foundational motor skill which is frequently used in sports such as cricket, softball and baseball. The action sequence of the overarm throw is linked to sports such as javelin, the forehand serve in tennis and passing the basketball and netball. The overhand throw can be broken down into four main sequences: position, aim, rotation and follow through. As previously stated, the overarm throw is integral to varied sporting and leisure activities, and even to everyday life. In learning the overarm throw, children begin to understand the strengths and movement capabilities of their bodies. Ensuring correct instruction and technique, students can further their own proficiency through adjusting the difficulties to suit themselves, i.e. increasing distance, aiming for harder targets, and trying trick shots. Successful learners will be able to execute the overarm throw proficiently, utilising this skill to further their knowledge and ability with more difficult fundamental motor skills, such as the catch and the forehand strike. The overhand throw is taught to students within the fundamental movement phase of development. This phase categorises the shift towards young children, generally between the ages of 2 and 7, exploring the movement potential of their bodies. The fundamental movement stage is further divided into the initial, elementary and mature stages. Ergo measures the competency of the given skill. For this video, we will be focusing on students in the elementary stage at grades 1 to 3. The initial stage of the overhand throw may be already explored by children during the infantile or pre-operational stages of development. This is categorized as the child's first goal-oriented attempt to perform the motor skill, and as such may lack coordination, poor rhythmic sequential movement, and over-exaggeration and restrictive body movement. Ensuring proper instruction in the early years with a focus on foundational level students will ensure greater participation and engagement with physical education for the duration of their schooling. Successful learners may experience increased self-confidence, coordination and strength, leading to greater participation in both school and out-of-school sport. Key teaching points. Child's eyes are focused on the target area throughout the throw. This is known as eyes on the target. The student's elbow should be bent and held at shoulder height. This may also be referred to as W. The student should rotate their hips so that the opposite shoulder is in line with their target, or commonly known as rotate. The student steps towards the target area with the foot opposite their throwing arm. This is known as step forward. The student should shift their weight from back foot to front foot, also known as back to front. The student should lead the throw with their elbow after the child's throwing arm follows through, down and across the body, formerly known as the follow through. Common mistakes made. Child is not standing sideways to the target. This is when the child faces their target instead of being side-on to the target. This could be fixed by instructing the child side-on. If needing assistance, point the foot opposite to their throwing hand towards their wall or target. Taking the object upwards in preparation to throw. This is when the child brings the object above their head with a straight or slightly bent elbow in preparation to throw. This should be fixed by instructing the child to hold the object with their throwing hand at ear level. This prevents them from holding it too high, thus having no range of motion. Students not keeping their eyes on the target. This is when a student has difficulty concentrating on their target. A simple fix to this would use a target that is brightly coloured in order to keep their attention. This might be particularly helpful for students with ASD. It is also useful for the teacher to indicate where the student should be aiming to throw. Rotate trunk and hips in block formation. This is simply when a student's body moves all together instead of separately. A way to fix this is to demonstrate to the child how to follow through with your body when completing the overarm throw. For foundation children, you may get them to twist from side to side to see how their body is able to turn. Ending the throw with their throwing hand pointing. When the student has released the ball, they are not continuing to follow through with their throwing arm. This can be fixed by demonstrating to the child how their throwing hand should touch the outside of their opposite knee as they follow through. Positioning the student and teachers. They must position themselves to face the front of the student. This will allow the teacher to view the child's stance is correct as well as their arm movements. It is important to understand where to position yourself, as you need to be able to see that the child is following the KTP for this activity. If you are facing the back of the child, it will be difficult to see if the child is focused on their target. The child must stand side on to the target wall with the shoulder opposite to their throwing arm facing the wall. They must also be at a distance of 10 feet from their target. Modifying equipment to teach the FMS to diverse learners. Targets. Decrease the size of the target they are aiming at. This will help the students to increase their accuracy. Instead of just aiming at hitting the wall, you could place tape with an X on the wall and ask the students to aim at the X. Or likewise, you can increase the target they are aiming at if they are more skilled. Partner. This can help the student improve their accuracy. Including a partner in this activity will allow the teacher to be able to focus on more than one student at a time. This also allows for the student to improve their accuracy by getting them to focus on a smaller target, their partner's hands, as well as their distance. If for every 5 catches you tell the students to take a step back. Distance. Increase the distance between the students in the target area. This is a simple yet effective way to teach the diverse learners. For every 5 to 10 times they hit the target or the wall, you can move them an extra 5 feet from the target. The students will have to learn how to alter their previous throw to account for the extra distance. The object. Depending on how advanced your students are, you can use a vast array of objects. This could be a beanbag, although the object's shapes to the hand is easier to throw than a tennis ball. A vortex or a softball. These items will be difficult as they're both tough objects to hold and may bounce back. For more information, go to the Australian Curriculum website on the Health and Physical Education page, the ACT Health website on the Healthy Children and Young People page, and the Good Habits for Life website on the Fundamental Movement Skills page.